Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
If you have a knee or a hip that's just not working properly, you're not alone. But there are some new procedures that could really bring you some relief. In today's Neighborhood Health Watch, we're going to talk about total joint replacement. And joining us is Dr. Cyrus Kump. He's an orthopedic surgeon at Parham Doctors Hospital. Thanks so much for being with us.
Sure. Thanks for having me.
Let's get right into the technicalities here. Let's talk about the advantages of direct anterior approach versus a posterior approach to the hip joint and what all of that means.
Yeah, what does that all mean?
Yeah.
Well, there are several ways we can approach a hip joint to put in a total joint replacement, and two of the more popular ways is through the front approach, or the direct anterior approach, or the posterior approach, or posterior lateral approach. And more often folks do use the posterior lateral approach, but in an effort to solve some of the problems that we had with joint replacements, or occasionally still do, more folks are turning to the direct anterior approach. The advantage of that would be not to disrupt muscles that we would disrupt in the posterior approach, and we were able to just push two muscles apart in order to gain access to the hip joint and place a hip replacement. So you have less, a quicker recovery actually, and less discomfort in general, and in general less blood loss. And hopefully in the long term we won't have hip dislocations, which are rare in all events, but we hope to make them even more rare of event after these kind of replacements.
And let's talk about robotic surgery, because there's so many procedures these days that are aided by robotic surgery. So talk to me about that.
So robotics uses a computer, obviously, and the option or the advantage there is we're trying to put a joint in that's perfect. We would love to put the perfect joint in, and we never probably will, but we know what joints work best and in what alignment and position they work best, and that's where the computer and then the robot helps guide the surgeon. The surgeon is in the surgery using the robot, but is being guided by the robot with the computer, and we're able to get precision through a CT scan that we can enter into the computer, and so we're getting very precise alignment and placement, and we can match this component to people better.
Okay. And real quick, let's talk about, you've got new advances in anesthesia.
Right. So, you know, I think the myth with joint replacement is that it's a tough, miserable process to go through. In the last 10 or 15 years, we've greatly improved the anesthesia, and it's a much easier process to go through for folks, and we can get them through the process of a joint surgery in a quicker time, more comfort afterwards, or less pain afterwards, and in that effort get them out of the hospital quicker, which is also a goal, because patients do better once they are out of the hospital and at home and recovering.
Great.
So,
okay,
yes,
Dr. Kump, thanks so much for being with us.
Thanks for having me.